Welcome to the first MBBS, and the purpose of this presentation is to give you the overview, timeline, curriculum, and the assessment pattern of the MBBS undergraduate course. And the timeline of this MBBS course, it has been somewhat changed for this batch because of the corona pandemic and other issues. And the first professional, will start from February 2022, and the completion of the teaching will be in December 22, and the university examination will be in 23. So the total duration will be of 11 months. In the previous year, it was 13 months, so the major difference is there is a curtailment in the duration of the first MBBS. And the second professional starts from February 23, and the teaching ends in January 24, and the exam will be in February 24. So the second professional will get one extra month in this course. And similarly, the third professional part 1 and part 2, and your internship will start in July 26 and will completed in June 27. So in short, this is the roadmap of your MBBS timeline, and this is available on the website of National Medical Commission, and the total duration is of 53 months, and you will get your MBBS degree after the successful completion of MBBS, that is in June 27. Now, some overview about this competency based medical education. As you all know that since last 2 to 3 years, new competency based medical education, it has been incorporated, and you all are very eager to know about what are the changes. I am just giving you the salient features of this competency based medical education. That is, there is an incorporation of the foundation course that has been this incorporation is in the, obviously in the first MBBS, and in this foundation course the purpose is you to acquaint you with the environment of the medical college, environment of the hospital. It will help you to improvise and build up your communication skills, the doctor patient relationship, and certain basic points or the basic training that are required for this MBBS course. Then early clinical exposure. Majority of you know that the clinics, your clinical training will start from the second MBBS onwards, and obviously in the first MBBS many students feel that okay, I am learning this anatomy or the physiology or the biochemistry, but what is its clinical relevance? And until and unless you don't know, because you all are here to become an MBBS. So until and unless you don't know the importance of each topic as far as the clinical relevance is concerned, then your interest can be somewhat diluted, and that's why early clinical exposure in the first MBBS, it has been incorporated. And dear friends, not only during the first MBBS but throughout your journey, you always have to try to correlate each topic with what is its clinical importance. You are studying the theoretical aspects, that is fine, but you always try to incorporate the clinical importance of that topic. Right? Then yes, attitude, ethics and communication module, that is also known as an ATCOM module. Now, the need of incorporation of this module into your MBBS curriculum is that nowadays you also have heard through the media or the newspaper that there are many issues coming up with doctors. And dear friends, it is not due to the doubt of the knowledge or the skill of the doctor, but many a times the problems are due to the attitude, the communication skill, and that's why this module, it has been incorporated. And this module, in comparison to the previous two, this module, it will, there are certain sessions and it will run throughout your first MBS, second MBBS, final part 1 and part 2. Okay. Then yes, very important, alignment and integration. If someone asks me to emphasize on only one topic of the medical education, then I will tell that the major difference in the medical education and the other education is you don't have to just suppose in the first MBBS there are three subjects, you just learn the three subjects and forget this and then you focus in the second MBBS. No, it is not going to be helpful. The topic that you learn in the physiology, say for example the blood pressure regulation, then what is the normal blood pressure regulation in the physiology, the same you have to remember and you have to apply this into the pathogenesis of the hypertension. The same you have to apply, then okay, these are the target site for the drugs that are helpful in the pharmacology. Then the same you have to use that knowledge, all the knowledge, for the management of the hypertension in medicine. The same you have to use that knowledge for understanding the complications of the hypertension. And suppose there is a complication, whether the macrovascular or microvascular, so the management of that complication, many times the surgical approach is also required. So, in short, what I want to tell is the more and more you will align the topic, the more you will dissolve the boundaries of the topic, the more you will learn the topic holistically. If you can see the topic from a wider perspective, then you can know the subject better, you can give your input better, and it will be very helpful in your overall career. And that's why we have also from our side we have also incorporated the alignment means the suppose you are learning the anatomy of the heart, at the same time you will learn the physiology of the heart, so that is known as an alignment. And integration is of again of two types, the horizontal and the vertical integration. Horizontal we have already discussed. Vertical means there are many topics. Say for example, now we take another example, diabetes mellitus. So you learn the physiology of the blood sugar regulation. Then at the same time you will learn about the pathogenesis of the diabetes. Then you will learn about in the pathology. Then you will learn about the drugs that can be helpful to manage this disorder and the pharmacology. Then you will learn the overall management of the type 1 and type 2 diabetes in the medicine as well as in the surgery, as say for example the management of the complications of the diabetic, that is diabetic feet. So this is known as a vertical integration, and there are separate sessions in your timetable incorporated for this integration. Then skill training. Yes, that previously also the skill training is there, but now this skill training, it has been specifically categorized in each subject, that these skills you have to perform it. These skills you have to perform under the guidance, and the teacher will assess that skill and it will be certified in your logbook. There are certain communication skills, certain procedural skills that you have to acquire. Okay. And yes, very important that we all have faced the overall crisis during this corona pandemic management, and we all have realized that the management guidelines, forget about the corona, but for any pandemic the management guidelines is different, to deal with the pandemic is different, and that's why the pandemic management module, it has been incorporated. So the MBBS undergraduates, they get this knowledge about the pandemic management. And as I've told you, the skill training, then the skill, it will be incorporated in the evaluation also. Okay. So now I will tell you the topics, or sorry, the subjects in the first professional. These are the human anatomy, then human physiology, and biochemistry. In the second professional, pharmacology, pathology, microbiology. And yes, previously the forensic medicine was there in the second MBBS, but now it has been upgraded and it is in the final MBBS part 1. So forensic medicine and toxicology, ophthalmology, otorhinolaryngology, also known as the ENT, ear, nose and throat, and community medicine. Now dear friends, there are certain subjects that you will learn in different professionals also. Say for example, the community medicine you will learn in the first professional, in the second professional, in the third professional part 1, but the final exam of the community medicine will be in third professional part 1. Similarly, even though the forensic medicine and toxicology it has been upgraded in the third professional part 1, but you will learn this subject in the second MBBS also, but the final examination will be in third professional part 1. And in the third professional part 2, the general medicine, general surgery, pediatrics, obstetrics, and gynecology. So, this is all about the subjects that are covered in the different phases of the MBBS courses. Now, something about the CBME assessment. I've already told you that there is a more focus, more emphasis is given on the competency based assessment. And here, your competency, there are certain competencies in which you have to reach up to the level of the nose. Then, certain competency you have to reach up to the level of nose. How? There are certain competency you have to reach up to the level of the source. Then not only the source but shows how. So there are different levels of the competencies, and there are certain, as I've told you, the competency of the communication skill. Okay, now this assessment is divided into the two parts. One is the internal assessment, and second is the external or university assessment. In the internal assessment, obviously there are two main evaluation. One is the theory evaluation, theory internal examination, and the practical internal examination. And dear friends, as I have told you about the different skills evaluation, that will be evaluation of the competencies. So this is the another addition in this new CBME based curriculum, that you have to manage the logbook also. The different competencies are assessed, they are reported, notified, and evaluated, and they are there in your logbook of each subject separately. And this assessment of the logbook, they will carry a separate marks of your internal assessment. Fine. And as I've told you that the EdCom module, it will incorporated in the each phases. So these competencies are also evaluated throughout your different professionals, and the your performance in the theory internal examination, practical internal examination, logbook, and EdCom competencies all will collectively decides your internal assessment marks. Now, how or what is the pattern? This question will strike you, that what is the pattern of your the theory papers? Now, the theory papers, it consists of the structured long questions. It means that the different segments are asked and there are individual marks for each segment. Then short notes will be there. Then some clinical problem, some clinical case has been given, narrated, and the certain question has been asked, and you have to give the answer of that question, and obviously the answer in brief. So these are the different types of the questions in the theory internal assessment. And in the practical internal assessment, obviously there are the practical exercises in the pre and the paraclinical subject, as well as the clinical exercises in the clinical subject. Then objectively structured practical examination OSP and objectively structured clinical examination. These terminologies are new for you, but gradually you will know about all these terminologies. I'm not going to go into the detail of this terminology in this session, but in short, you have to do some practical or some skill station, and that will be assessed. Okay, then mini clinical examination, and then you have to perform some skill, and that will be observed and assessed by the examiner. That is known as a directly observed procedural skill, that is DOPS. So these are some of. Then there must be some variation according to the subject. I'm not telling that this will encompasses the practical assessment of all the subjects, but these are the different basic practical evaluation exercises. Fine. Then that before going to the university examination, there are certain essential requirements for appear in the university examination that you all must know. That this day-to-day assessment, your logbook assessment evaluation, this ATCOM competency evaluation, different internal examinations, all these you prepare your final internal marks in the theory and the practical, and you have to get minimum 50% aggregate marks in both combining theory and practical. And out of this two, minimum 40% of the marks in the theory and minimum 40% marks in the practical is essential for the appear in the university examination. So this is the one prerequisite for appearance in the university examination. Another prerequisite is your attendance. And here there is again some change has been done, that there is a separate attendance in both theory and practical is essential. And in theory, as like previously, the 75% attendance is required, while in case of the practical, minimum 80% of the attendance is required. Okay, so this is in short about the overview of your MBBS roadmap, the subjects that has been taught, the internal examination assessments. Okay, now welcome you all to the first MBBS, and you give your it's my wish from inside that this whole journey that will be going to the very enjoyable way, and you will learn a lot, and you will come up with an competent Indian medical graduate. Best of luck and heartily welcome to you all. Thank you very much.